Good afternoon. Can everybody hear me okay? Yeah, good, because I don't have a very strong voice. So welcome everybody, and thank you for coming. It is indeed an honor to be here and especially follow so many wonderfully passionate speakers in this field. This is a very important field. And when I started into this field, we didn't actually have such a thing that we were worried about called electromagnetic radiation. Mostly what we would be looking at would be like food allergies and chemical sensitivities and toxicities. But in electromagnetic pollution brings in another aspect into our health, and we need to look at how the big picture falls out when we have all these other things going on, and then on top of it, electromagnetic sensitivity. So, as Rena has already mentioned, and you can see in this slide, environmental health is essentially a public health issue. When I think of environmental health, I'm doing more in my head, like you see on the next slide. So, traditional doctors and I was trained to look at symptoms of a patient and not necessarily think of how all those symptoms fit together, but I always had questions like, why does this patient get this kind of dermatitis? And there were never any answers. And so I quit asking questions after a while, but deep down I always had a lot of questions about why do people get different types of illnesses. And so in this particular, in environmental medicine, we look at root causes. So if you think of your symptoms as the tip of an iceberg, as in this picture, and you don't attack the symptoms initially, like giving nasal spray for rhinitis or giving a pain pill for a headache. Instead, you go below the tip of the iceberg and you look at all the other variables, like what sort of allergies does this person have to inhalants, to foods, to chemicals? What sort of infection does this person have? Bacterial, viral, fungal. And in the bacterial, we're all seeing more Lyme disease. What sort of hormonal issues are going on? A lot of times the hormones are going to be disrupted by environmental causes, such as chemicals, even in very low doses, can disrupt hormones. And now we know radiation can also disrupt. And then what sort of toxins can that person be harboring that they could have accumulated over a number of years? And you can read it there on the slide. And then in the end, how is that person's nutritional status holding up? Because without appropriate nutritional status, they won't be able to detoxify. And there's various agents that we can all be encountering, so I just basically mentioned them all. But we have various chemicals that we talk about, such as volatile organic compounds. And we talk about persistent organic pollutants, POPs, and those particular chemicals can stay in our body for many years. And different industrial companies, such as Monsanto, has put out a lot of those over the years. This slide didn't work out very well. I'm going to skip it. So whatever the body takes in, we have to excrete. We either have to utilize what we take in, we have to process it, and eventually, if we're not going to use it for nutrients, we have to excrete it. So there's different ways the body takes things in, and there's different ways the body can excrete. Pathways of removal can be skin, through heat depuration, like sauna therapy. We can drink a lot of fluids and excrete things through our kidneys. Our liver will work hard for us to excrete, and then through our bowel. We can excrete through tears. We can even excrete through discharges like rashes. And so we all have different genetic blueprints. And this is one thing that one of my teachers, Dr. McLennan, instilled in us, is everybody has a different genetic makeup, and we all have different ways that we're going to detoxify. We're not all the same. And again, our nutrient status is very important. The timing and exposure, when we get our exposure and how long we're exposed, is important. And then the additive effect of exposures. You've seen this slide before. This is from Dr. Bill Ray, and this is just, again, talking about how we're exposed to so many different things and all the different ways that we are going to process this. So one of the things you often hear doctors in our field talk about is the total load principle. So again, it's the additive effect of your chemical exposure, and on top of that now we have the electromagnetic exposure, and how do these things interact, okay? Toxins are called xenobiotics, and they can be stored in different parts of our body, our hair, our nails, our organs, and we have all the different toxins. A lot of our toxins that we're exposed to are fat soluble, and what is one of the most fat soluble areas of our body? The brain. Yeah, the brain is hugely made up of fats, and so the brain can be very strongly affected by the environment and the toxins in the environment. And a lot of our patients will come in complaining of brain fog. It's a big symptom. Okay, so the toxins can be excreted, distributed, depending on what the toxin is. So that's a similar slide that I got from Rena. Rena already said that's too complicated to look at, so I'm going to pass over it. This is another way to look at detoxification system. If you have a healthy detoxification system, you're better able to cope with what you're dealing with in the environment. Again, this can be genetically based, or it could just be overloaded with toxins. If you have a healthy one, you're going to deal with things a lot better. So you need periods in the day where you're not being exposed, where you have downtime. And so here's another way to look at it. If your total load is high, you're not in control anymore. You're not in control of your life anymore, as you've heard the testimonials today. That's how people's lives have been disrupted, and they've had lack of social contact due to their total load getting so high. And then we get free radical production in the body, and the cell membranes start having problems. And then this can just cascade until you get the right nutrients on board. The free radical production cascades, and patients just lose. This is part of Martin Paul's work. He talks about this and how nitric oxide gets out of control, and it needs to be controlled so that the patient can start recovering. One of the things we can do in the clinic is we give intravenous vitamins and minerals, and sometimes it really helps the patient start getting control of their symptoms, because sometimes they're not absorbing very well. The gut isn't healthy. So that's just a fancy way of talking about the body burden and looking at, you need to have less toxins coming in. You want to increase your output somehow, either by heat deprivation or drinking a lot of fluids. You want to increase your metabolic rate, increase your body temperature, enhance your antioxidants, drink a lot of water. And the last one is, just assist excretion through the bowels. The bowels, the skin, the kidneys. Okay. So one of the really important organs in detoxification is the gut. If the gut's unhealthy, it adds a huge burden to the body. So something that needs to be done is cleaning up the gut when we're seeing patients. So one of the mnemonics we use is weed, seed, and feed. So weed toxins out of the gut, seed good things back in, and feed healthy, appropriate foods. One of the things we find makes a really, really big difference in our patients is discovering and finding out if they have a gluten intolerance. A lot of patients start getting well when they go on paleo diets, anti-inflammatory diets. So when their total load is low, they are again empowered to start getting better. So how do we figure out what's going on? So one of the things that we have to do is take a good environmental history. And so you've seen this chopped mnemonic already today. I'm going to go over it a little more. So you want to look at what's going on in their community, and in the case of this conference, you want to find out if there's any cell phone towers near them. You want to find out what kind of electronic devices are they using at home. They may also have chemical sensitivity, so you want to find out what sort of materials are in the home. Are they living in a brand new home? Some people get sick when they move into brand new homes. What sort of hobbies do they have? Are they being exposed to doing stained glass, using leaded solder? What's happening in their school? Is their school near a lot of cell phone towers? Because we don't have any laws yet in Canada to prevent cell phone towers in your schools, but some countries do, as you've heard today. In their personal life, you want to know what's happening with their dental hygiene, which you've heard talked about today. Do they have amalgam fillings? Sometimes even just having metal implants in their mouth can be an issue. What kind of mattress are they sleeping on? You've heard that today. Does it have metal springs? But if you're looking at other mattresses, you have to rule out chemicals also, and other cellular devices that they're using. And then diet, of course, you want to look at it if they're eating anything allergic. And if any of the drugs they're taking could be causing symptoms. So I'm going to start talking about the cases, okay? Now, so in my practice, electromagnetic stuff's kind of crept up. You know, sometimes the patients were educating me because this started being new about 10, 15 years ago. And the main thing you learn as a physician is to listen to your patient, because your patient isn't there because they want to make it up. And so this is a story about one of my patients who'd already been an environmental patient before she met me, and she was well-versed on what to do and how to take care of herself. And she started not feeling well, and she couldn't figure out what it was, and she kept calling me, can you help me, what's going on, let's do some lab. And so I did some lab, and I always put in thyroid. And we started noticing that her thyroid was going all over the place. And so you can see here that, for those of you who are physicians, her TSH, the normal range is 0.34 to 5.6 for her lab. She was living in Montreal. And so her TSH dropped. Her T3 looked normal, but her T4 went way up above normal. I mean, so she's looking like she's hyperthyroid, Graves' disease or something. And she did have a history of Graves, but why would it come out of the blue all of a sudden? And then a little while later, so the first one was December 19th, then January 10th, her TSH went up and her T3 dropped below normal and her T4 dropped below normal. So this is like ricocheting all over the place. And then her TSH dropped again, her T4 went way up, so she was bouncing all over the place. So what do you think was going on? You don't have the benefit of seeing the next slide yet. No, it wasn't a cell tower. It wasn't her phone. Close. No. We talked about what's different, you know, because usually if you talk about it long enough, you'll figure it out. No, not a smart anything. I mean, not a smart meter. She said, do you think it could have anything to do with the fact that my son bought me an iPad for Christmas? And so she was using it already before Christmas in December. And that was it. Like, I had never experienced that before in a patient. And so she stopped, on her own, she stopped using the iPad immediately, and she started getting better. And there is some report in the literature of that with cellular technology affecting the thyroid. Not a lot, but there is some. So case 2 is about a 29-year-old female who went on a trip with her relatives. She already knew that she had some environmental sensitivities herself. Her aunt already knew about having sensitivities. When they arrived at their destination, she felt really ill. They were in a restaurant and she started acting like anaphylactic, and they thought they were going to have to call an ambulance. But instead they went outside, she got some fresh air and started feeling a lot better. So then after some discussion, they thought because of the history of gluten in the family, she went gluten-free for that trip and started feeling a lot better. Her anxiety and depression lifted because it was really large. Those symptoms. She maintained being gluten-free when she got back home, and her marks improved dramatically just going gluten-free. And to put herself through university, she worked in bars as either a waitress or preparing drinks or being hostess. She'd been doing this to put herself through school for quite a while. But then she was offered a job in Toronto here in one of the restaurants to be a manager. And so she started in that position. She was quite excited, but she couldn't stay in that position because they just put in, I guess, a stronger Wi-Fi in the restaurant, and she couldn't tolerate it, so she had to leave. And then she started realizing that she was having issues with Wi-Fi in other parts of the city, like she'd go and visit people in the Queens Quay area. I guess there were some apartments there that had stronger type Wi-Fi, and she couldn't tolerate it there, and she'd have to leave. So she's now married, and she's finding she has to live in more remote communities that don't have this powerful Wi-Fi. I don't know what she's going to do when 5G comes in. But she's finding, for work, she works independently. She does contracting, and she works in the literary business, so that works for her. Okay. So in case 3, it's about a 49-year-old female who was living in a poured concrete house that's built with, where you pour the concrete in the styrofoam blocks. And this person already knew that they had chemical sensitivities. They were good at following the diet and eating appropriately and avoiding chemicals, and they were doing well. Then they started developing twitching in the legs and finding it difficult to settle down and sleep and generally feeling unwell. The cell phones did not work well in that house. Any signals coming in, it was really hard to get a signal in the home. The house was hardwired already. There was no Wi-Fi inside the house. And so the problem in this situation was that they got a cordless phone, which had a DECT, which we've spoken about already in the meeting. And so the DECT on the phone was causing a lot of symptoms because the DECT phones are constantly emitting a signal, which Magda taught me about. Magda said even the signals can be 2 houses away from a cordless phone. So you could be reacting to someone else's cordless phone in your house. Anyway, in this case, it was within the house, and it was probably reverberating within the concrete walls, which makes it even worse. Okay. Case 4 is a sad case. This was a school teacher, and I'm beginning to find out a lot of my sad cases are school teachers because there's a very little recognition in the public school board for this type of illness. So this teacher would also wear a walkie-talkie when she was having recess duty. So she was getting exposure from her walkie-talkie. She had a router in her classroom that she was noticing that she was reacting to. And she was starting to realize that she couldn't function in her classroom. And she was just teaching a young age group like grade 2. So she had to start figuring out ways to handle this, and they wouldn't let her turn the router off. So she really, I noticed when she would come to see me, she was still being affected by it. She had a lot of trouble talking to me and explaining her situation because her brain was really fogged and it wasn't working anymore. So she basically tried to get disability. They wouldn't allow it. And she eventually had to leave her job, and she started doing other work. So she's no longer a school teacher. So I think that's really sad that we don't, I mean, I know as physicians we should be doing more. I find I'm so inundated from day to day, working like more than 8-hour days, that like there's not a lot of time left over to be advocates for these people. I mean, you can write them letters, but it doesn't matter because in this case, the school board doesn't want to listen to this type of situation. Okay. This is actually not my patient. This is one of my colleagues' patients. I asked him. I knew he probably had a good case history, so he gave me one. So this is a 5-year-old boy now. He was normal until he was 18 months old, after which after his 18-month-old immunization, he started having problems. And he was first seen by my colleague when he was 2 years and about 9 months old. So at the time that my colleague saw him, he was hyperactive. He didn't recognize his parents. He had no speech other than he could recite the odd number and mutter letters to himself, but he didn't really communicate with anybody. So he was put on a gluten-free diet, and initially, along with soy-free, casein-free, often you'll see those three together, and no sugar. And there was some improvements, not major improvements. He was put on nutritional supplements and digestive enzymes and probiotics too. By age 3, his condition was still active and severe, but his parents noted that he was addicted to using their laptop computer. So they were also living in a very high-intensity electromagnetic radiation part of Stittsville, which is just outside Ottawa. And there were 30 Wi-Fi networks that would come up on their computer when they looked on the Wi-Fi network. So they decided to stop him from accessing the laptop. Within days, he began to respond to his name. And then all Wi-Fi was removed from their home, and they purchased a Faraday canopy, which you saw in one of the pictures earlier, for him to sleep in at night. The parents started noticing progressive increase in his understanding and interaction. His frequent night awakening stopped, and they started working on his detoxification. And once the Wi-Fi was off, he started showing less effects of hyperactivity. And they realized that he'd been drinking 3 to 4 liters of water a day once the Wi-Fi was turned off. But that only lasted 2 weeks, and it's like his body was starting to work on detoxification way better once the Wi-Fi was turned off. And so that's when he really started getting better. So that was part of the equation for him to recover. So I'm almost finished. Rena will be happy to know. So many of my patients, just some general observations, have noticed that when they hold their phone, they get arthritis. I don't know if very many of you have noticed that with your patients. Their joints that are touching the phone will get arthritic. And it's not really a particular rheumatoid or osteoarthritis pattern. Okay. So this, actually I have a better link I'll give Rena, sorry. I think this is the wrong talk, but there is a link that you can go to look for cell phone towers and find out how many cell phone towers are near your home. But this is the wrong link. I've got a better link, sorry. I can put that in and you can update it. Okay. All right. Yeah, basically we're done.